The human body is a marvel of complexity, its intricate structures arising from a seemingly simple starting point, a single fertilized egg. The journey from this single cell to a fully formed human being is a testament to the elegance and precision of embryonic development. This process, guided by a blueprint encoded within our genes, involves a carefully orchestrated series of cell divisions, migrations, and differentiations. Understanding this complex choreography is crucial for comprehending not only the normal development of the human body, but also the origins of congenital anomalies that can arise when these processes go awry. In this exploration, we will delve into the fascinating world of embryology, focusing on the development of key body regions, including body cavities, the diaphragm, the respiratory system, and the head and neck. We will use the case of HD, a young boy presenting with a neck mass, as a lens through which to examine these developmental processes and their clinical relevance. The case of HD serves as a stark reminder that the blueprint of life, while remarkably intricate, is not immune to errors. By understanding the origins of these errors, we can better diagnose, treat, and potentially prevent congenital anomalies, ensuring healthier futures for children like HD. 3-year-old HD arrived at his family physician's office with a common childhood ailment, a severe cold. His symptoms, a persistent cough, a runny nose, and general malaise, were all too familiar to his parents. However, it was a swelling on the left side of HD's neck that raised alarm bells. On examination, the physician discovered a palpable mass, approximately 2 centimeters in diameter, located in the submandibular region. The initial diagnosis pointed towards lymphadenitis, an inflammation of the lymph nodes often triggered by infections. HD was prescribed a course of antibiotics and sent home. A week later, HD's cold had largely subsided, but the neck swelling persisted. In fact, it had grown larger, now measuring 3.5 centimeters in diameter. This development prompted a referral for further investigation. The persistence of the mass, despite the resolution of the initial infection, suggested that something more than a simple case of lymphadenitis was at play. HD's case underscores the importance of considering multiple diagnostic possibilities when encountering pediatric patients with neck masses. While lymphadenitis is a common and usually benign cause, other possibilities ranging from congenital cysts to more serious conditions like neoplasms must be carefully considered. The development of body cavities is a fundamental process in early embryogenesis, laying the foundation for the organization of internal organs. This intricate dance begins with the formation of the trilaminar embryonic disc composed of 3 germ layers: ectoderm, mesoderm, and endoderm. The mesoderm, the middle layer, plays a pivotal role in the formation of body cavities. During the 3rd week of development, the lateral mesoderm splits into 2 layers, creating a fluid-filled space called the intraembryonic coelom. This initial cavity undergoes a series of partitions, giving rise to the 3 major body cavities: the pericardial cavity, housing the heart, the pleural cavities, encasing the lungs, and the peritoneal cavity, containing the abdominal organs. The formation of the diaphragm, a muscular partition separating the thoracic and abdominal cavities, is essential for this compartmentalization. The development of body cavities is a testament to the intricate choreography of cell movements and tissue interactions that orchestrate the formation of our internal architecture. Understanding these processes is essential for comprehending the origins of congenital defects that can arise when these steps go awry. The development of the respiratory system responsible for the vital exchange of oxygen and carbon dioxide is a remarkable feat of embryonic engineering. This intricate system arises from a simple outpouching of the foregut, the primitive tube that will eventually give rise to much of the digestive tract. This outpouching, called the laryngotracheal groove, appears during the 4th week of development and marks the beginning of the respiratory system. The laryngotracheal groove gradually elongates and separates from the foregut, forming the trachea and the lung buds, the precursors to the lungs. The lung buds undergo a series of branching events, giving rise to the bronchi, bronchioles, and ultimately the alveoli, the tiny air sacs where gas exchange takes place. This branching process, essential for maximizing the surface area available for gas exchange, continues even after birth. The development of the respiratory system highlights the remarkable capacity of embryonic cells to differentiate into specialized cell types, forming complex structures capable of carrying out essential physiological functions. Understanding these processes is crucial for comprehending the origins of respiratory disorders that can arise from developmental disruptions. Section 5. The Symphony of Structures, Head and Neck Development. The development of the head and neck is a complex and tightly regulated process, involving the intricate interplay of multiple germ layers and signaling pathways. This region, home to vital structures involved in breathing, eating, speaking, and sensing the environment, arises from a series of bulges and clefts that form in the developing embryo. These bulges, known as pharyngeal arches, appear during the 4th and 5th weeks of development and play a crucial role in shaping the head and neck. Each arch is composed of a core of mesoderm, surrounded by ectoderm and endoderm, and gives rise to specific muscles, bones, cartilages, and nerves. The development of the face, external ears, nasal cavities, and sinuses is intricately linked to the formation and differentiation of these pharyngeal arches. The development of the head and neck is a fascinating example of how a relatively small number of embryonic structures can give rise to a wide array of complex and interconnected components. Understanding these developmental processes is essential for diagnosing and treating congenital anomalies that can affect this region. Section 6. When development veers off course, congenital anomalies. While embryonic development is a remarkably precise process, errors can occur, leading to congenital anomalies, also known as birth defects. These anomalies can range in severity from mild to life-threatening, depending on the nature and extent of the developmental disruption. Understanding the causes and consequences of these developmental errors is crucial for improving diagnosis, treatment, and prevention strategies. Gastroschisis, a congenital defect in which the intestines protrude outside the abdominal wall, serves as a poignant example of how errors in embryonic development can have significant clinical consequences. This condition, often diagnosed prenatally through ultrasound, typically requires surgical intervention shortly after birth to repair the abdominal wall defect and return the intestines to the abdominal cavity. Congenital anomalies like gastroschisis highlight the importance of understanding embryonic development and the factors that can disrupt this intricate process. By unraveling the causes of these anomalies, we can develop targeted interventions to improve outcomes for affected individuals.
Dr. Valentino, to the OR, please.
Section 7. Unraveling the mystery common causes of neck masses. Neck masses in children are common, often presenting as a source of concern for parents and a diagnostic challenge for physicians. Understanding the common causes of these masses is crucial for guiding appropriate investigation and management. Lymphadenitis, the inflammation of lymph nodes, often in response to an infection, is a frequent culprit, typically presenting as tender, enlarged nodes. Congenital cysts, remnants of embryonic development, can also manifest as neck masses. These cysts, usually benign, can arise from various structures in the head and neck, each with its characteristic location and appearance. Branchial cleft cysts, for instance, arise from remnants of the pharyngeal clefts, while thyroglossal duct cysts originate from a tract that connects the developing thyroid gland to the tongue. While most neck masses in children are benign, it is crucial to maintain a high index of suspicion for more serious conditions, such as neoplasms, particularly if the mass is persistent, growing, or associated with other concerning symptoms. Section 8. Seeking answers. Diagnostic tools and investigations. Diagnosing the cause of a neck mass requires a systematic approach, combining a thorough history and physical examination with appropriate investigations. The history should focus on the duration, growth pattern, and associated symptoms of the mass, as well as any relevant past medical history, such as previous infections or surgeries. Physical examination should assess the size, location, consistency, and mobility of the mass, as well as the presence of any associated features such as lymphadenopathy or skin changes. Imaging studies such as ultrasound, computed tomography, or magnetic resonance imaging play a crucial role in characterizing the mass and guiding further management. In some cases, fine needle aspiration cytology, a minimally invasive procedure that involves obtaining a sample of cells from the mass using a thin needle, may be necessary to confirm the diagnosis and guide treatment decisions. Section 9. The enduring significance of embryology in medicine. The study of embryology, far from being a purely academic pursuit, holds profound implications for clinical medicine. Understanding the intricate processes that govern the formation of the human body from a single fertilized egg is essential for comprehending the origins of congenital anomalies, diagnosing and treating developmental disorders, and advancing regenerative medicine. The case of HD, the young boy who presented with a neck mass, serves as a poignant reminder of the clinical relevance of embryology. By applying our knowledge of head and neck development, we can appreciate the wide range of possible causes for his condition, from benign entities like lymphadenitis and congenital cysts to more concerning possibilities like neoplasms. The enduring significance of embryology lies in its ability to bridge the gap between basic science and clinical practice, providing a framework for understanding the complexities of human development and its impact on health and disease. As we continue to unravel the mysteries of embryology, we open doors to new diagnostic tools, treatment strategies, and ultimately healthier futures for generations to come.